On behalf of Student Scientific Society of Medical University of Silesia in Katowice, I would like to thank you for coming and taking part in International Medical Congress of Silesia of 2024. My name is Martin Rojek, and I have honor of moderating. It's my pleasure to coordinate the experimental medicine session. We would like to explain you the rules of these sessions. The order of presentation will be the same as the abstract. The maximal time of the presentation is 7 minutes and 3 minutes for the discussion. If the presenter exceeds the time, he or she needs to move on to the conclusions and finish the presentation as soon as possible. We would kindly ask the jury to access the scientific value, way of presenting, discussion, and own contribution of each author. To begin, I think we can start with the first presentation. I would like to ask the presenter. I would like to ask to present the paper. Implementation on algorithm to access similarity of biosignals in patients after SHK.
Okay. So good morning. So I'm sharing my screen, right?
Can we please ask you to share your screen with the presentation?
Okay. Okay, it should be visible. Is it?
It is visible. Thank you.
Okay. So good morning. My name is Radosław Powecki, and I will present the results of my thesis. And the work was done under the supervision from Agnieszka Uryga at Wrocław University of Science and Technology. So the aim of the study was to implement dynamic time warping algorithm to assess the similarity of biosignals characterizing the autonomous nervous system and cerebral autoregulation in patients after a subarachnoid hemorrhage, and I used the Python programming language. And background of the study, it was to explore this relationship deeper, since autonomous nervous system and cerebral autoregulation play crucial role in patients after subarachnoid hemorrhage. So speaking of those two systems, autonomic nervous system is part of a bigger nervous system that is responsible for regulating blood pressure and heart rate, and it's doing it without conscious control. On the other hand, cerebral autoregulation maintains a constant level of cerebral blood flow regardless of perfusion pressure. And here are some metrics I extracted from those two systems. Systolic blood pressure, heart rate, high frequency component of heart rate variability, and also tissue oxygenation index. And as it for medical data, it was necessary to pre-process them. So I removed the artifacts, I removed the outliers using the interquartile range method. Then I applied linear interpolation to remove the gaps. Why linear interpolation? Since it doesn't influence data so much. And at the end, I applied the normalization. And I used the generalized logistic algorithm to normalize data because it assumes real distribution of data, which is true for such medical data. It's cased to 0 to 1 interval, and it has increased robustness to outliers. However, it has also its disadvantage, which is that some data can be missed because cannot be pre-processed because of some optimization errors. Here are the stages of analysis. So first, I determined the metrics using the ICM Plus software. Then I assessed their availability and qualified them for analysis. So on the one of the previous slides, you have seen that I grade the baroreflex sensitivity, and this metric was removed from further analysis since its availability was too little. Then the metrics were pre-processed, what I just told, standardized to a specific length, analyzed using the dynamic time warping, and statistical analysis was performed at the end. Speaking of dynamic time warping, is an algorithm that assess similarity between two signals, and the output of dynamic time warping is alignment cost. In current bibliography, usually studies use one of those methods to calculate the alignment cost. I decided to check them all and also to call them specifically for my work. I told about metric standardization, so I decided to standardize metrics to 60 hours. Then I performed two types of analysis, block analysis. So I took 3 blocks. First block was 24 hours, the second 24 hours, and the third 12 hours. Blocks were to simulate phases after subarachnoid hemorrhage, because there are 3 phases. There is acute phase, subacute phase, and chronic phase. And what I also performed, what was innovative in my study, was window analysis. So in blocks, I also performed the window analysis, so calculated the alignment cost for each window with overlapping. This is files that I received. So for each method of calculating the alignment cost, I received the results for the metric from autonomous nervous system compared to the cerebral autoregulation. And this is how the exemplary results look like. Alignment cost for each block, for each method. And then I checked if there is significant difference in alignment costs between the consecutive blocks. If it was significant difference, I left them like this. But if it wasn't significant difference, I calculated the mean value. And this mean value I compared to the survival rate. And for some data, I found out that higher alignment costs, so bigger desynchronization between the metrics, leads to is a negative prognostic for survival. On the other hand, the synergy between the autonomic nervous system and cerebral autoregulation may contribute to improving the effectiveness of treatment. However, my data was kind of limited, so it was more like a proof of concept. So further analysis is needed in this aspect. And that's all. Thank you.
We will now move on to discussion. We would like to ask the jury for any questions.
Good morning, and thank you for the excellent presentation. My question, I have actually 2 questions. First is about the methodology of the research. So how many patients you studied, and how many patients you obtained the data, what was the criteria for inclusion to your study? And secondly, what is the main goal and results of the study?
Okay, so about the first question, I got data from 15 patients. So that's why I told that it was limited and more data is needed for bigger analysis. And also those patients were after subarachnoid hemorrhage, and it was part of the grant project that explored the relationship between autonomous nervous system and cerebral autoregulation. The main goal of this study, was to, if patient is like accepted to the hospital with subarachnoid hemorrhage, it's needed to examine them pretty fastly. And this method, since we measure some let's say basic signals from patients, we can calculate those metrics and we can assess what is the risk for a patient.
So on the inclusion criteria was the SH8 in the patient. So you didn't take into account some other factors which can influence, for example, heart rate, systolic blood pressure, and so on. For example, drugs used by the patient, some other clinical conditions, and something like that.
Yeah, only subarachnoid hemorrhage. It was the criteria.
Thank you very much.
I have a question, Agata Stanek. Please tell us what was your contribution to the study?
My contribution. So I wrote those classes for preprocessing, for dynamic time warping. I performed all the analysis. I found about this normalization method, and while I was working on this study, I found out that this normalization is needed for dynamic time warping because first I checked like raw signals, and those differences in values on y-axis lead to that the dominating signal was aligned to themselves. So basically, I found out that normalization is needed. Then I found this method of generalized logistic, applied it, and went with the analysis. So I didn't measure those signals. This is what I received, but from signals, it's my contribution.
Thank you.
Now moving forward, I would like to ask the presenter of the presentation the usefulness of forced oscillation technique in diagnosis of bronchial asthma in seniors. Is there a presenter of this presentation?
Yes, I am. I'm.
So we would like to ask you to share your screen with us.
And can you see my screen now?
Yes, we do, but please, can you go full screen?
Oh, now it should be good, right?
Okay, it's fine, thank you.
All right, I will open my camera. Give me a minute because there's technical problems. Oh, do you see me now?
Yes, everything is fine. You can start.
But now I can't see my presentation. Give me a second, please.
So please, maybe can you turn off your camera? Can you see your presentation right now?
No, give me a moment, please. I have to maybe escape. I'm so sorry for that.
No worries. We can see your...
Tak, kamerę wyłączyłam, bo próbuję dojść do tego, jak wrócić do prezentacji. Jakby. O.
My widzimy prezentację.
All right, can you see my presentation now?
Yes.
So sorry for these technical problems. My name is Martyna Miodońska, and I'm honored to present you my study about the forced oscillation technique, the usefulness of forced oscillation technique in diagnosis of asthma in seniors. My colleagues and I wondered what to do when conventional method failed. For a good few years now, while we examine patients, we have been thinking of alternatives to spirometry, which, despite being the gold standard, cannot always be performed correctly by the patients. Limitations may relate to organic problems or lack of cooperation. So the aim of this study was to compare spirometry parameters and forced oscillation technique parameters and their both reversibility tests in diagnosis of asthma in seniors. We recruited 189 patients who met inclusion criteria. 114 of them were randomly selected and invited to participate to the study. At the same time, 110 senior citizens older than 60 years of age without diagnosed asthma or obstructive diseases were selected for the control group. We performed physical examination, asthma control test, forced oscillation technique. After 5 minutes, we performed spirometry. Then we added 4 doses of salbutamol to perform reversibility test. After 15 minutes of salbutamol, we repeated FOD and spirometry. What's important, patients should discontinue short-acting beta-2 mimetics, ipratropium bromide 8 hours before the test, and long-acting theophylline and long-acting beta-2 mimetics 24 hours before the test. Now I will tell you something about the method. The forced oscillation technique, FOD, is a non-invasive method used to evaluate the mechanical properties of the respiratory system. It involves applying sinusoidal pressure wave generated by the loudspeaker at a known frequency and amplitude. In this study, we used 5 Hz to the patient's airwaves. These oscillations do not interfere with patient's natural respiratory cycle. The device measures respiratory impedance, which consists of 2 parameters. Resistance, R, reflecting airway patency, and the reactance, X, which is associated with the elastic properties of the lung. Different frequencies of oscillation provide information about different parts of the bronchial tree. Low frequencies, such as 5 Hz or 8 Hz, 5 used in our study, are particularly useful to assessing both central and peripheral airways. In obstructive diseases like asthma, resistance increases and reactance decreases. Now let's move to the results. What we assessed? We assessed how FOD parameters, R5 and X5, and spirometry parameter FEV1 differ in asthma patients with the healthy individuals. We found that asthmatic had significantly higher resistance, which means R5, resistance at 5 Hz, and lower lung reactance. FEV1 was also lower. In 101 patients in the control group, both diagnostic tests were performed. Positive test results was observed in 3 patients using spirometry and simultaneously in 2 using forced oscillation technique. We asked, does the bronchodilator response relate to how well asthma is controlled? We found that in well-controlled asthma, both delta R5 and delta FEV1 correlated strongly with asthma control test score above 19. In poorly controlled asthma, the correlation disappeared. We measured how well each parameter, delta R5, delta X5, and delta FEV1 identifies asthma. We found that delta R5 had the best diagnostic value, sensitivity about 89%, specificity 88%. Delta FEV1 was good, sensitivity 81% and specificity 82%. And the delta X5 was less reliable, sensitivity on level of 59% and specificity 72%. So, ladies and gentlemen, we in this study, we tried to answer the question, can we use forced oscillation technique instead of spirometry? Well, our results are promising, but I will leave this question open. Maybe next year I will tell you something more about it. Thank you for your attention, and be free to ask me your questions.
Now I would like to ask the jury, are there any questions?
Can you hear me?
Yes, I hear you.
My English not fine. I'm interested in another comorbidities in asthma, which may have specific with your works, only simple asthma or another part of asthma, maybe with another part of another diseases?
Yes, thank you for your question. In this study, we didn't differ asthmas, endotype and any type of asthma. But I think that there is a lot of comorbidities which may have an impact on the forced oscillation technique. For example, chronic obstructive pulmonary diseases or restrictive diseases, and I think heart diseases too, like pulmonary hypertension, for example.
And what about it's more popular in our days, cigarettes and shisha with asthma?
Yes, of course.
Are you interested in?
Yes, I will have a table. Oh, I don't have this table right now, but of course, smoke, alcohol is make asthma and chronic obstructive pulmonary disease worse. So we are planning the research about the exacerbations of asthma using pot. Maybe I will tell you something more about the cigarettes then.
Thank you.
Thank you.
Are there any more questions?
Congratulations, a very interesting study. Could you tell us about the limitation of your study?
Yes, the limitations of our study was, for example, infections in our patients, because few patients dropped out from the study because of the infection. I said about the lack of cooperation from the patients, especially in spirometry, because when we perform the spirometry, patients have to perform it good to close the circle of spirometry. And when he cannot, or she, when patients cannot perform it correctly, we don't have results to compare with. So that I think a few patients dropped out because they didn't show on the next visit with us. So there are the main limitations of my study.
But how many patients are you planning to include to the study?
First of all, we wanted to include 200 patients, but we didn't have it at all at our clinic, so it's about 100.
Okay, but it's a very small group, yes.
Yes, but
one of the limitation.
it is preliminary study right now. We are working on the bigger group.
Yes, and then the last question, please tell us about your contribution in the study.
Yes, I am a medical doctor, so I examining the patients, performed forced oscillation technique, performed spirometry, both with reversibility tests. Then I put all the data into the Excel sheet. Then I compared it and write something, and now I am here.
Okay, thank you very much.
Thank you so much.
Thank you. Now, with the next questions, I would like to ask the presenter of assessment of derived cardiomyocytes using bioinformatics analysis of RNA sequential and single-cell RNA sequential DNA data.
Thank you very much. Good morning, distinguished Good morning, dear distinguished members of honorary jury and guests. I have today a pleasure to present the results of my project where I used bioinformatics to assess the purity of iPSC-derived cardiomyocytes using RNA-seq and single-cell RNA-seq data. This pointer doesn't work. Okay, thank you very much. Let's start from the background. Induced pluripotent stem cells derived cardiomyocytes are a novel tool for providing studies on cardiac diseases. And it's now, I think, the best tool for assessing cardiac providing Okay, let's continue. iPSC-derived cardiomyocytes are best tools for doing in vitro cardiac studies. Currently, FDA recommends iPSC-derived cardiomyocytes for assessing cardiotoxicity. The problem with them is that in each study, they must be differentiated freshly, so we must assess their purity before experiments. Most commonly, flow cytometry is used for assessing their purity. However, it has several limitations. For example, we cannot assess the same population that we use for experiment because the cells that went for flow cytometry or immunostaining are wasted. And also we have limited number of proteins because both techniques are low throughput. So the aim of the study was to establish the robust, cost-effective method to evaluate the composition and quality of iPSC-derived composite cardiomyocytes using bulk RNA-seq and single-cell RNA-seq reference data. It is worth underlining that we don't want to do RNA-seq for assessing, but we want to use the data if were generated in other experiments to additionally use them to assess our cardiomyocyte. So in this case, it's very cost-effective. The materials and methods. We used iPSC-derived cardiomyocytes from the cell line UKKI036A from the European Bank of Stem Cells. This is the protocol of differentiation based of Lyon et al. And we collected cells at day 23. This is the confirmation of pluripotency of cells at our facility. We used 4 markers and confocal microscopy, and we confirmed that for pluripotency markers were expressed. The molecular biology workflows, the RNA was isolated with one RNA kit. It underwent control with nanodrop qubit and bioanalyzer. We prepared the libraries with stranded total RNA prep, ligation with Ribo 0. Sequencing was performed on Illumina NextSect 550 with 2 high output kits. The analysis, the trimming was performed with Quindalore, quality check with FastPC. Alignment was performed using Bowtie 2 algorithm with aligning to GRH38 reference genome. Sum to bump conversion was performed, and genome level quantification was performed in future counts. We used reference single-cell seq data from Gancharova et al. 2021. Based on published results, we selected crucial markers, and statistical analysis was provided using our own protocol in R and Python, and output was the chart and p-values matrix. The results. This is the results of the concentration of RNA and real value. As you can see, we have quite integral RNA for our sequencing experiments. Let's go to the most important experiments. On the left side, you will see the genes. On the right side, there are cell clusters. Most clusters are from RNA-seq single cell data. And our RNA-seq are the last, this orange one on the last column. The cell clusters, first one is iPSC that are not differentiated cells. Next, we have cardiomyocyte PCM are a very immature cardiomyocytes. Then we have cardiomyocytes day 12, 24, and day 90, and support cells, STR stromal cells, SC endothelial cells, SM smooth muscle, and the AND endothelium and XDC ectodermal cells. As you can see, our population have very low expression of the first gene, suggesting that we didn't have undifferentiated cells. Also in the second marker, which is marker of proliferation, also we have very low, so it's good for our cardiomyocytes. The TNT2 marker is a troponin T, so our cardiomyocytes expressed somehow in the level of 12, 24-day cardiac myocytes from the single cell. And also the next markers were also similar to the results for cardiac myocytes in day 12 and 24. Beside of one, could you move the bar so we can see the charts fully? Besides of this one, that was relatively high compared to other population, but on this chart we have a median and interquartile range, and we decided to provide additional analysis. Now I cannot change slides. I still cannot change slides. Okay, and we performed analysis of outstanding values. So we found that in most cases, there were outstanding values in other populations, but didn't significantly impact the median. But in our population on RNA-seq data, we didn't find it. We also analyzed p-values. We can statistically significantly say that our cells were not induced pluripotent stem cells, and the cells were mostly similar to the PCM and cardiac myocytes day 12 based on the results. So let's move to the conclusions. We developed a cost-effective technique for assessing cardiac myocytes from induced pluripotent stem cells. In fact, the cost was mainly the cost of power for computer for 1 hour analysis. And this approach allows precise identification of cell type composition within the same data that was already generated in the experiment. The study was funded by National Science Center, and we also want to sincerely thank the crew of Department of Microbiology and Immunology with Professor Chuba. Thank you very much. I'm waiting for questions.
Thank you. Now we will kindly ask the jury for any questions to the presented work.
Right, so one question from me, because I'm not sure if I understand it well. So what was exactly the wet job, the wet laboratory job which you performed in this experiment? So what kind of analysis of the cell culture was the beginning of the study?
In this study, I was performing experiments on cardiomyocytes from induced pluripotent stem cells. I'm treating them with different conditions, but it's another goal of this study. But I additionally used the data to assess the purity of that cardiomyocytes from the RNA-seq that I generate besides the other experiment. So I very cheaply can assess purity of my cardiomyocytes using bioinformatics.
All right, but the cardiac myocytes, they were developed from the iPS by yourself, or you just bought the already prepared cell line?
Yeah, I was differentiating them in the lab in Zabrze. I also was isolating
the starting population was the iPS cells.
Yeah, we bought iPS from the UK.
Okay. Additional question, because please let me understand it correctly, because in the goals you said that the goal of the study is to create, the cost-effective bioinformatic tool for the assessment of the cells. So what exactly have you done? Because as far as I understand, you just measure the expression profile of selected genes in single cells, and
I've created a tool that you can upload the data from your RNA-seq experiment, and it gives you the charts that were generated here, so you can assess the population of your cardiac myocytes. It provides normalization comparing to the single cell data, and also generate this chart that allows easy comparison to the reference population that will underwent single cell.
And so we implemented an algorithm for automatic analysis of the data from the sequence.
In this case, yes. Okay. Thank you very much.
There is one small technical issue. Please, we kindly ask the online participants to mute their microphones while they are not speaking. Are there any more questions? I guess not. So we should follow to the next questions. That is pan-immune inflammatory value as a predictor of cognitive decline in geriatric patients.
Can you hear me and see me? Because I'm trying to share my screen, but I cannot share it because. Okay.
Are there technical issues?
No, but I think you could see right now.
Yeah, we can.
Okay. Okay. Good morning, body of commissions, professors, and my dear colleagues. I would like to show you today a presentation about the pan-immune inflammatory value as a predictor of cognitive decline in geriatric patients. So to go further, I would like to give you a rough introduction about this study specifically. And as we all know that cognitive decline is frequently observed in hospitalized geriatric patients, and it can impact the recovery and long-term outcomes. And in this study, we used the MMSE, which is the mini mental state examination, and it is comprised of 30 questions in these screening tools, and the score of below 24 indicates cognitive impairment in the geriatric population. And PIV is a very composite biomarker, and it derives from a very specific blood morphology, which is the neutrophils, lymphocytes, and monocytes, and also platelets. And it reflects the systemic inflammation somehow together with the immune status. So in this study, I would like to show you to show you the exploration about the relationship between these specific biomarkers and to assess whether it can be used as a prediction to see whether cognitive status in hospitalized geriatric patients could be assessed, and also to know whether we could further use the full potential of clinical utility, which is already existing in the hospital prior to admission of the patient. So in this study, we recruited about 2,098 patients from the hospitalized geriatrics patient, and they are hospitalized in this department, and the data we collected was from January 2017 to December 2023. And here I present to you the PIV formula, which is we use the neutrophil counts, the platelet counts, monocytes, and also lymphocytes. And again, not forgetting the MMSE, which is the mini mental state examination. And this study was conducted using the statistical analysis performed by the Statistica. And in this study, these results, I will show you the p-value of the PIV together with the MMSE, and both of them are significantly statistically significant. And you can see that the PIV in men is slightly higher, and but we can see similar differences observed in the MMSE somehow. And in the next graph here, I will show you the correlation between the MMSE and the PIV in the whole group. Here we use a scatter plot, and it clearly shows that there is a negative correlation between the PIV and cognitive function in both the gender woman and man, with a row of negative 0.07 in women, and in men it was negative 0.008. And in conclusion, PIV, we can see that PIV is significantly linked to cognitive function, and also it can reflect the systemic inflammation in aging, and it could potentially use as early biomarkers in cognitive decline. And in this, we can see that further research is needed to explore the mechanism linking between this inflammation and psychs to cognitive impairment, and also it can use as a predictive marker for cognitive decline in the geriatric population. And so thank you for your attention, and I look forward for your questions.
I have some part of my visions. In my studies, I'm interested in immunology with my friend, Professor Chuba. What about another comorbidities disorders in this group, maybe depression? What about taking medicines which maybe impact on morphology results? In depression, cognitive worst, sometimes antidepressants medicines can have inflammation issue.
If I understand your question correctly, thank you for your questions, but if I understand your question correctly, it's about the disease progression using the antidepressant medication.
Progressing?
Because I don't
suppose with anti-progressive.
Anti-progressive, okay. I'm not sure about that, because in this study we specifically just recruited patients with cognitive decline, and that is how we use that kind of data to perform the statistical analysis without having to see any other comorbidities with the studies. Okay.
We had a study with Professor Chuba about 30 years ago, and some of antidepressive drug drugs may anti-inflammation issue, and it's good to take depression. And do you know about this function on cognitive disorders? In psychiatry, is a term the paradimension, not dimension simple in depressive disorder. And after the depressive note is good for take care. So cognitive is better. So
yes, but that is a very good good input from you. But I'm not really sure about the dimension things that you are mentioning, and I will look forward further into this. I appreciate that.
I think that it's a study very curious, but in the future, it's good to have to get another issues.
I am deeply sorry,
your
but
work.
the time for discussion is up, and we unfortunately have to move forward towards the next presentation. Again, I'm deeply sorry. We are on the short schedule. I would like to ask the presenter of the presentation invisible risk to bisphenol contamination in an early childhood.
Good morning. My name is Monika Pilniewicz. Good morning. My name is Monika Pilniewicz, and I am PhD candidate and physician in the departments of pediatrics and allergy at Medical University of Łódź. I would like to present you my project entitled Invisible Risk Bisphenol Contamination in Early Childhood. Why research devoted to bisphenols are so important for all of us? Actually, they are widely used in the industry as precursor of plastic, epoxy resins, and thermal paper. Consumers are exposed to bisphenols by eating packaged food, drinking water from plastic bottles, by dust inhalation, and via direct contact by toys, textiles, and electronic devices. How bisphenols affect our health? Bisphenol A is an endocrine disruptor that can disrupt neurodevelopment, cognitive function, metabolism, and trigger allergic reaction. Bisphenol A, F, and S were included to the list of prioritized substances to be determined in human biomonitoring studies by the European Union. The aim of this study is to determine the urinary concentrations of bisphenols in children from Poland, to estimate their daily intakes, and to examine the main factors of exposure. This project is part of Polish mother and child cohort study, implemented as part of a grant Opus NCM. The study population constitutes 150 children at the age of 7. They were invited to the Department of Pediatrics and Allergy in Łódź. First component of the study was detailed questionnaire, which covered information about place of residence, number of siblings, socioeconomic status, parental age, educational level of parents, and occupational activity. The second component was collection of morning urine samples. We stored them and sent to the Institute of the Ruhr University Bochum in Germany to determine concentrations of bisphenols. Let's move on to the results. The most abundant bisphenol was bisphenol A, present in all analyzed samples, with median concentration 2.5 micrograms per liter. Bisphenol F was present in 95% of samples, with median concentration 1 microgram per liter. Bisphenol S was present in only 20% of samples, with median concentration below the limit of quantification. Maximum concentrations was 90 micrograms per liter for bisphenol F, followed by bisphenol A, 27.3 micrograms, and bisphenol S, 7 micrograms. When it comes to median daily intakes for bisphenols, it was 45.9 nanograms per kilogram of body weight per day for bisphenol A, 33.1 for bisphenol F, and 4.4 for bisphenol S. What is worth emphasizing, newly established tolerable daily intake of bisphenol A, according to the European Food Safety Authority, is only 0.2 nanograms per kilogram of body weight per day, which means that the safety level in all analyzed samples was exceeded. Figure 2 shows the distribution of individual and socio-demographic characteristics of children for each bisphenol compound. We observed that boys had, in general, higher bisphenol concentrations than girls. Environmental tobacco smoke, higher socioeconomic status, and better maternal education were associated with higher bisphenol concentrations, apart from bisphenol A, in which socioeconomic status was negatively associated. We also noticed that underweighted children had lower bisphenol A concentration than recommended weight and overweighted children. To conclude, bisphenol A exposure in Polish children were above safe level in 100% of the samples we're comparing to the tolerable daily intake established by the European Food Safety Authority. A positive trend was found with environmental tobacco smoke, maternal educational level, and socioeconomic status. Due to the harmful effects of bisphenols on human health, reduction and prevention of the supply of this compound should be implemented. Thank you for your attention.
Thank you. Now we will move forward to the discussion. Are there any questions?
Because you basically, first of all, congratulate you study. It was really nice and well designed. But my question is about the designing of the study, because you use the cohort from the Reaper PR study, which is much bigger, about 2,000 pairs of children and mothers, but you only selected 150. So can you tell me a little bit more about your selection and how you possibly avoid the selection bias?
Yes, this cohort, we had a base 450 patients to invite, and I personally invited patients, patients, I call them. It wasn't very easy to invite them to the department because they need to come, they need to spend whole day in our department because we had a lot of compounds of this cohort study, not only this questionnaire and collecting of urine samples. We tried to convince them, of course, but after many years from the start of this cohort, it wasn't very easy. So unfortunately, only 150 children we were able to invite.
Because you selected for your study less than, let's say, 7% of the total population. So what do you think, is there any risk of selection bias? Because maybe, you know, some particular persons who are mostly affected by, you know, your, let's say, study compounds were selected and it will not reflect the data from the general population.
Yes, you're right. But this is preliminary study. Maybe we will be able to recruit more patients from this cohort. this is the first time when we assessed bisphenol level in urine. We didn't do it earlier in earlier steps of this cohort. So I hope we will have more patients and our outcomes will be more reliable.
As you know, the problem is not how many patients you enroll, but the other, how do you select the patients to avoid the possibility of biases related to such a study, especially if it's not a prospective study, it's just cross-sectional study, so it's very prone to different biases.
Thank you.
Once again, thank you for the presentation. And now I would like to invite the author of the work, Impact of Sedation, Death, and Cognition in Spinal Anesthesia.
Yes, good morning.
Please share your screen with us.
Should I share my presentation?
Yes, please.
Yes, okay. 1 second.
Could you please go full screen for us?
Yes, 1 second.
Thank you. Everything's fine. You can start presenting.
Yes, so my name is Gabriela Milkantaite. I'm from Lithuanian University of Health Sciences. I'm undergrad medical student, and my tutor is PhD candidate. So we made a research of impact of sedation, death, and cognition in spinal anesthesia. So bispectral index versus clinical assessment. So a little background. So as you know, postoperative cognitive decline in the elderly is pretty commonly observed, but still requires attention. So cognitive decline in the elderly, of course, common after spinal anesthesia when sedation is onset. Traditional sedation assessments are subjective and inconsistent. So bispect index monitoring provides an objective tool to guide sedation depth. Aim of this study was to compare the impact of sedation depth monitoring according to bispectral index versus clinical assessment on cognitive performance in elderly patients undergoing spinal anesthesia. So I would like to overview our study a little. So criteria for patients to be included in this research. So it were elderly patients older than 65 years, had elective knee replacement, and underwent spinal anesthesia plus additional sedation. So those patients were randomized into 2 groups. So first group, bispectral index group. So sedation was guided by bispectral index monitor, and target bispectral index was from 70 to 80, which means that patient is slightly sedated and will quickly answer to stimulus. And control group, where sedation was controlled by clinical signs. We used Ramsey sedation scale, score 4, which is that patient is asleep, but also will quickly answer to slight stimulus. So we used sedative as additional, I mentioned propofol, and it was administered by group protocol. Then how we managed to measure cognitive assessment. So we used MMSE test, so mini mental state examination, which contains max score 30. So we measured MMSE within 4 timeline spots. So before operation, 2 days after operation, 30 days post-operation, and 90 days post-operation. So let's jump to results. So as you can see, there's not that much of a difference between both groups. MMSE scores remain stable and comparable between groups across all time points. So as you can see, all p-values are more than 0.05, so statistically insignificant. So there was no a big difference between those 2 methods. And in conclusion, sedation depth monitoring using bispectral index versus clinical assessment did not significantly impact cognitive performance in elderly patients undergoing spinal anesthesia. So it didn't have a much big difference in between those two methods, and we enrolled 60 patients. So pretty enough, I would say, like controlled groups. So do you have any questions? I would love to answer them.
Once more, I have a short questions. We use propofol to anesthesia in electroconvulsive therapy. Is may addiction effect on electroconvulsive therapy results?
I would say not, because propofol we use as additional sedation in this case, because in spinal anesthesia we don't went, of course, under general anesthesia. So propofol was used more like a sedation to just because some patients are experiencing discomfort, stress. So propofol just gets them a little more sedated, and the whole like surgery experience gets less complicated and more pleasant for patient. So once administered, I wouldn't say that it's potential addictiveness risk.
What do you think of another anesthetic medicine in electroconvulsive therapy? We don't use benzodiazepines to have more epilepsy effect in electroconvulsive therapy. Is propofol for you is not the best drug for it?
For sedation, we also use midazolam for a little maybe calmer effect. I can't answer specifically why propofol was chosen, because it's my tutor's PhD dissertation work, so I can't answer why she decided to enroll patients who were sedated with propofol. But I believe that midazolam, for example, maybe it's a little safer drug for like additional sedation.
Thank you.
Thank you.
Please tell us what was your contribution to the study.
For contribution to the study, I basically did all the statistical analysis, was involved in containing all the data from patients. I did all the MMSA tests before operations, after like those 4 timestamps. So I was on set the whole anesthesia process because I'm interested in being an anesthesia doctor. So yeah, we just like I was doing most of maybe statistical things and observing and collecting data.
Thank you.
Thank you.
Thank you for your presentation. Now I would like to ask the author of use of HPLC to determine the content of short-chain fatty acids in selected food products.
Good morning, ladies and gentlemen. My name is Michał Nicze. It is a great honor to present our work today. Okay, so let me start it again. We are pleased to perform our results. Our work is about the content of short-chain fatty acids in selected food products. All the stages of experiment were performed entirely by us in the laboratories of the Department of Pharmacology in Katowice. Now let me briefly present the structure of our presentation. And the whole idea for this study arose from our doctoral research, which involves analyzing the impact of medical interventions on short-chain fatty acids concentrations in stool samples. Therefore, to validate the method, we started with dietary supplements containing sodium butyrate, and we successfully presented our results at the SIMC conference last year. Here we are presenting the results of the content of short-chain fatty acids in the selected food products. And our next step will be testing this method in stool samples, and we hope it will be the beginning of this application in the future. For the introduction, short-chain fatty acids are organic acids containing several carbon atoms per molecule. They are products of dietary fiber fermentation in the large intestine. They also play a key role in colonocyte metabolism, and alterations in their intestinal content compositions may be associated with different gastrointestinal diseases. Butyric acid, naturally present in rancid butter, is also widely used in dietary supplements because of its trophic effects on the intestinal mucosa, which may be benefits in treating different gastrointestinal tract conditions such as irritable bowel syndrome or inflammatory bowel diseases. And many of our patients dealing with these health problems ask us about whether they can modify their diet and consume more fermented products such as sauerkraut in order to avoid using butyric acid supplements. And that is why we decided to analyze 15 selected dairy and fermented products likely to contain short-chain fatty acids, as shown on this slide. In order to measure the content of these acids, we use the methodology previously described in the literature with slight modifications. We weighed 2 grams of each product. Solid samples were homogenized with a hand blender. An internal standard cyheptamide was added, followed by 5 milliliters of diethyl ether for extraction. After centrifugation, the supernatant was transferred and the diethyl ether was evaporated. Then the residue was dissolved in methanol using an ultrasonic bath. And then it was centrifuged again and filtered into vials for chromatographic analysis. Finally, the analysis was performed using high-performance liquid chromatography with a UV-Vis detector. And here you can observe the chromatograms we obtained. The first one at the top comes from the standard solutions of propionic, butyric, valeric, and caproic acids. And the following chromatograms belong to food samples we analyzed, in which, unfortunately, we haven't detected any notable peaks corresponding to short-chain fatty acids. Especially, there were no visible peaks in the butyric acid region. However, the peaks of the internal standard were visible, and it confirmed that the extraction process was effective and the analyte loss during sample preparation was minimal. And here we are showing the comparison with a chromatograph of a dietary supplement containing sodium butyrate we obtained last year It is the curve depicted in red color. Hopefully it is visible. And the contrast is clear and visible. I mean that the concentration of short-chain fatty acids in the tested food products were generally below the detection threshold of our methodology, whereas the content of butyric acid in the supplement was much higher and easily detectable. And that is why it allowed us to conclude that dietary modification alone is not an effective strategy to supplement short-chain fatty acids. Of course, our work has some limitations that are listed in here, and our results require further studies on broad scope. As for the conflict of interest, we do not have any to declare. Thank you very much for your attention, and if there are any questions, we would please need to answer them. Are there any questions?
So we would like to ask you the generic question. What was your contribution to this work?
So I have already mentioned all the steps of this experiment were performed entirely by us at the laboratories of the Department of Pharmacology. I mean, from the very beginning, the conceptualization, then we researched the literature in order to find the proper methodology. It was applied last year, and we started with examining the content of sodium butyrate in dietary supplements, and we presented the results last year, and it was prolonged for this year results in much more advanced samples like food samples. So every single step was performed by my colleague and myself.
Thank you very much for your presentations. Now we will follow with nutrition and sleep quality among university students, comparison between academic and exam periods.
Hi, everyone.
Good morning. We would like to ask you to share your screen with presentation.
Yes, 1 minute. I think my screen is visible.
It is. We would like to ask you to go full screen.
Yes.
Thank you. We can start.
I will start. Thank you. Good day, everyone. My name is Simay Kundakçı, and I am a research assistant in Marmara University in the Department of Nutrition and Dietetics. Today, I will present my study titled Nutrition and Sleep Quality Among University Students, Comparison Between Academic and Exam Period. With the beginning of the university education, students move away from their familiar environments, make their own choices freely, and face various challenges such as adapting to new lifestyle and economic pressures. These factors can significantly influence their nutritional behavior, particularly during the exam period. The shift in routine and stress level might lead to change in dietary patterns and sleep quality. In this context, the purpose of the study explored how students' nutrition and sleep quality change between the academic period and exam period, and how these changes are related factors such as energy intake, protein intake, macro and micronutrient intake as sleep patterns. The total of 96 participants, 77 females and 19 males participate in our study. The participants were aged between 19 and 24 with a mean age of 21.1 years. The data collection was conducted in two phases, the academic period and the exam period. We evaluate students' food intake using a 24-hour dietary recall method focused on the energy, macronutrients, and micronutrient intakes. The energy and nutrients taken in daily diet were analyzed using the computer-assisted nutrition program, Nutrition Information System package, developed for Turkey. Additionally, sleep quality was assessed using the Pittsburgh Sleep Quality Index. Statistical analyses were performed using the SPSS 23, and a significance level of the P less than 0.05 was considered statistically significant. Looking at the water intake, we are looking at our results. Looking at water intake, 33 students reported a decrease in water consumption during the exam period, while 52 students increased their water intake and 11 students had no change. The difference in the water intake was statistically significant. P value is less than 0.05, indicating that students drank significantly more water during the exam period compared to the academic period. We are moving on to main meal intake. 9 students reported a decrease in the amount of the main meals consumed during the exam period. 20 students had an increase and 67 students had no change. The p-value for this comparison was no significant change in meal consumption between academic and exam periods. Regarding the snack intake, 22 students decreased their snack consumption. 54 students increased it and 20 students had no change. The p-value for snack intake was statistically significant, showing that students ate significantly more snacks during the exam periods. Now, let's examine the macronutrient intake. The data shows 79 students increased their energy intake during the exam period, while 17 students decreased their energy intake. However, there was no significant change in energy intake between the two periods. P-values equals greater than 0.05. For protein intake, 70 students reported an increase in protein consumption, while 26 students decreased their intake. The p-value for protein intake was 0.00, which is statistically significant, indicating a significant change in protein intake during the exam period. The percentage of protein intake also showed a significant change. 75 students had an increase in the percentage of protein they consumed, while 18 students decreased and 3 students had no change. The p-value for this comparison and change indicating a significant shift. Looking at the dietary fiber intakes, 75 students reported an increase in fiber intake during the exam period, while 21 students decreased their fiber intake. The p-value for this change indicating a statistically significant increase in fiber intake during the exam period. The daily folate intake increased in 59 students during the exam period, while 37 students decreased their folate intake. The p-value for this change indicating a statistically significant increase in folate consumption. Among the vitamins, vitamin A intake showed a significant change, with 62 students increasing their intake and 34 students decreased it. The p-value indicating a significant change in vitamin A consumption during the exam period. For vitamin E, 63 students showed an increase, while 33 students had a decrease. The p-value indicating a significant difference in vitamin E during the exam period. Lastly, the total PUC score, which measure overall well-being and sleep quality, showed a significant improvement during the exam period. 61 students had a higher PUC score, 23 students had a lower score, and 12 students showed no change. This p-value for the comparison indicating a significant improvement in students' overall well-being and sleep quality during the exam period. In conclusion, my study highlights the change in nutrition and sleep quality among the university students between academic and exam periods. Notable water intake, protein intake, and dietary fiber significantly increased, While snack intake and fluid intake also showed significant change, the total PUCU score increased, indicating better well-being and sleep quality during the exam period. This suggests that stressful periods like exams may lead to dietary and lifestyle change and that impacts students' overall health and sleep quality. Thank you for your attention. I wish you a successful Congress. Thank you.
Thank you for your presentation. Are there any questions from the jury?
Could you have any proposals for students?
I can't hear that, sorry.
Could you have any proposals for students?
Yeah, maybe I think I give you some proposals for the students. Which one is they increase their sleep quality. They maybe proper hours sleep and wake up. And one of these maybe decrease the caffeine consumption. And also they eat vitamin C, maybe. I think that's all.
Thank you. And now moving to the next presentation, body positivity, eating disorders, and BMI, a study among active women.
Good morning. Good morning. Thank you for opportunity to present my study. I represent the Jerzy Kukuczka Academy of Physical Education. My works tutor is Monika Marszałek, and I will present today my study, Body Positivity, Eating Behaviors and BMI, a study among active women. At the beginning, I would like to introduce what body positivity is. Body positivity is a popular trend, mainly observed in social media, in magazines, advertisement, and movies. Body positivity is approached with love and accept to one's body, regardless of body size, color skin, or any weakness of this body. Previous research indicates on impact of body positivity on well-being and body image satisfaction, but we still don't know how its impact on this trend on controlling body weight. What can be really important, taking into account how big problem is obesity now. One of the study also show that exposure to body positive images increased body image satisfaction, but decrease pursuit of fitness, what we can consider like negative effects with individuals, in case of individuals with obesity. So the aim of my study was deeper understanding of perspectives of female gym goers on body positivity, examine the correlation between these opinions about body positivity and eating behaviors, and also analyze relationship between eating behaviors and BMI. To conduct the study, I used two questionnaires. One questionnaire about opinion about body positivity was created by me. And at the beginning on this questionnaire was metrics with age, gender, height, and weight. Thanks to this, I could estimate BMI. answers in these questionnaires were coded from 0 to 4, and the maximum possible score was 52 points. And the lowest score indicated on positive opinion about positivity, and the highest scores indicated on negative opinion about body positivity. Second questionnaire was 3-factor eating questionnaire in Polish adaptation. And this questionnaire measures eating behaviors in 3 subscales: emotional eating, uncontrolled eating, and cognitive restraint. The survey was conducted both in person and online. In person, I collected data in fitness clubs. The study included 121 women attending fitness clubs from age 18 to 65 years old. 53 women was with BMI 25 kilogram per square meter, and 68 women had BMI below 25 kilogram per square meter. To assess the opinion about body positivity, I constructed scale where points from 0 to 22 indicated on positive opinion about positivity. Points from 23 to 30 indicated on neutral opinion about body positivity, and points above represented negative opinion about body positivity. So this group had neutral opinion about body positivity. In the results didn't show any significant correlation between opinion and emotion and eating behaviors. But the results show significant correlation between BMI and emotional eating, and also between BMI and cognitive restraint. Both of these correlations were positive. In the conclusion, we can say that really psychological factors are really important in controlling body weight, what show also this study and studies before, previous studies. I didn't show any significant correlation between opinion about body positivity and eating behaviors. But question is, what if we examine exposure on body positivity images, and we check if this has any impact of eating behaviors? So for sure, we need more, for further research, we need more study in this topic. Thank you. Is any question?
Could you tell us what are the limitations of your study?
Limitation is for sure this, that questionnaire what I sent online, I don't know exactly who will take part in this questionnaire, in this survey. This should be women with which attending fitness classes, but like online, I'm not sure because it was on group, and I am not sure if this woman really took part in fitness classes.
I have a short question once again. Your opinion, interdisciplinary between medicine, literature, medication, and medication. Franz Kafka, in his letters to Milena, wrote, "The man with obesity is good for reliance, trust." Well-being. What do you think about it?
What be? One more? Could you repeat, please?
What do you think about myth of famous Franz Kafka, who wrote in the letters to Milena, "The man with obesity is good for reliance, trust for him."
The body positive is good in... I don't understand.
For trust, reliance is good people. You wrote about well-being, yes?
Yeah, about well-being.
It's about your hypothesis. Yes.
People. I don't know.
This question is not directly in your studies. I think about your intuition.
About my intuition about how people react on body positivity?
Yes.
And I think that it's like two sides about this, because people with obesity can also have really mental problems sometimes, like depression. And sometimes this body positive can really give them some better mental being, what can impact on another behaviors, also eating behaviors. But on the other hand, this body positivity trend also cannot motivate people to changes. So it's like two hands, like two sides, and we don't know now. And current literature didn't show us how is answer on this question. If this is good for like social, for us, for obesity and for treatment obesity, or no, it's like that worse. This trend didn't show. Okay.
It's good. Thank you.
Thank you.
Thank you for this interesting discussion. Now I would like to ask the author of a quality assessment of selected vegetarian products available on the Polish market and their proprietary count. Unfortunately, the mentioned author is unavailable and not present today. So we will move to the next presentation, evaluation of the effect of combined use of metformin and Prostiban on breast and colon cancer cells. Unfortunately, this presentation is also unavailable. So we will move to the reflectance profile of solid pharmaceutical dosage forms in infrared spectral range.
Good morning. My name is Elżbieta Mickoś, and I'm happy to present this study reflectance profile of solid pharmaceutical dosage forms in the infrared spectral range. Second author is Paula Babczyńska, and our work tutor is Professor Sławomir Wilczyński. It is well known and well documented that light can interact with dosage forms, especially in ultraviolet and visible radiation, and may cause photodegradation of active ingredient in medicinal product. In contrast, infrared radiation is not taken into consideration as danger for active ingredients in medicinal products. We know that infrared radiation has low energy. However, it is responsible for thermal effect, and it has potential to induce thermal stress, degradation of active ingredient, and even formation of bioproducts. The aim of the study was to evaluate exposure of medicinal products to infrared radiation using directional hemispherical reflectance as quantitative method for assessing reflective properties to radiation. We included in our study 49 medicinal products. It was products, the measurements were performed on dosage forms. It was solid oral dosage forms and only tablets, different tablets. We also performed measurements on blisters. Blisters had different material, were made of different material and had different color and transparency. As method, we used directional hemispherical reflectance measurement, and this parameter allows us to measure radiation reflected in all directions. Quantitative assessment of light reflected by the sample allows to determination on how much radiation is absorbed or transmitted by sample, and in result we can assess interaction with spectral range. We used to measurement reflectometer Super Optics Corporation, and this equipment measure diffuse reflectance, specular, and also total reflectance in 7 spectral bands from ultraviolet through visible and also near infrared. As we see, we have received reflectance profile of tablets, tested tablets. And in the graph, you see that tablets have high reflective properties in visible spectral range and also near infrared to 1,700 nanometers. This radiation is reflected more than 75% and do not interact with dosage form. Infrared radiation 1,700 to 2,500 is less reflected, only about 40%. And this is why it can be dangerous for tablets. It can interact with them. The tested tablets had different color and were divided into groups, white and colored, and we see that reflectance of white and colored dosage forms do not differ in both tested spectral range. And I have to say that it is opposite to visible ranges, because in visible ranges, tablets, color of tablets is important for reflective properties. So we wanted also to know if blisters of these medicinal products protect from infrared radiation. And we divided blisters based on few criteria. The most important is material. We had blisters made of single layer PVC or PVDC, blisters made of multi-layer PVC, and multi-layer aluminum blisters. And as you see, only aluminum blisters protect from infrared radiation, and blisters made of other material block only 8%, 9% of this radiation. We also analyzed transparency and color. These results has a relation with material, and because of time, I will go forward to conclusion. In conclusion, our study showed that infrared radiation can interact with dosage forms. Because of thermal effect, radiation, it is important to design dosage forms and packagings as to reflect as much infrared radiation as possible. It is more important when we think about active ingredients sensitive for temperature. For these medicines, using a container that reflect, that have high reflective infrared radiation properties would enhance their stability. In this thermogram, you see this thermogram illustrates how infrared radiation influence on dosage forms. We heated in 3 variants dosage forms with infrared source, and you see that on the left you have temperature of tablet heated on without any protection, in the middle with protection of blister material, and this was transparent and colorless blister, and on the right with protection of blister and box. So we see that temperature is, even if we protect dosage form with blister, this temperature is high. Thank you for your attention.
Now moving to the discussions, are there any questions? So we would like to ask you, what was your contribution to your work and what was your inspiration?
Okay, I'm a pharmacist and I work in distribution of medicines. And for me, it is very important to distribute high quality of medicines, and in process of distribution that they do not lose of quality. And I understand that in transport or storage condition, especially in households, these medications can be affected with infrared radiation because, for example, patients do not properly storage. And my contribution, I was responsible for collected medicines, for data curation, measurements. I also participated in conceptualization and also statistical analysis.
Thank you for your contribution. Now, moving towards next presentation, safety and tolerability of electrical muscle stimulation, training in women of reproductive age. That is online presentation, I think.
Yes, it is online, and I will share this presentation.
Thank you. You can start.
Okay, thank you. Good morning, ladies and gentlemen. My name is Sara Krzysztofik, and I represent the Medical University of Silesia, together with MSc Anita Tekiela under the supervision of Professor Violetta Skrzypulec-Plinta. We conducted a study focusing on the safety and tolerability of electrical muscle simulation training in a woman of reproductive age. Today, I would like to present the findings of our research. So, what the EMS training is a training method that uses electrical impulses to stimulate muscle contraction. During an EMS session, a special suit is putting on the body, which you can see on the photo on the left. Electrical impulses stimulate the muscles to work, which allows for intensive and fast work all of muscle groups. The primary aim of our study was to evaluate both safety and perceived tolerability of an 8-week EMS training program among the healthy women. We wanted to determine if regular EMS training could be implemented safely and how well it would be tolerated by participants. To keep our study safe and reliable, we excluded people with conditions that might affect the result or make EMS unsafe. This included pregnancy, serious problems, heart diseases, infections, skin problems. We also excluded people using medication that affect muscles. The study was designed as an 8-week intervention. We recruited 38 healthy women aged between 20 and 40 years.
Participants engaged in EMS training twice a week, with each session lasting 20 minutes. The exercise protocol included compound movements such as squat, lunges, push-ups, and core stability exercises performed under EMS suit. A cycle of 4 seconds contraction, followed by 4 seconds rest. All sessions were supervised by a certified EMS trainer. To monitor the effects of EMS training, we observed several parameters like menstrual cycle changes, muscle fatigue, the light onset muscle, and general well-being. For this, we use tools such as visual analog scale and original tolerance questionnaire and the feeling scale. Measurements were taken at 3 time points, before the intervention, halfway through, and after completing the program. For our statistical analysis, we applied for the Wilcoxon signed ranks test for department such as tolerance, rating, and well-being scores. We used repeated measurements ANOVA to analyze data like muscle soreness. A significance level of P less than 0.05 was considered statistically meaningful. We observed a significant reduction in muscle fatigue and improvement in participant general well-being. After 8 weeks of EMS training, muscle soreness appeared mainly after the first session, but gradually decreased over time, and no significant change in menstrual cycle length were noted. It's important that overall 92% of participants rated the training as well or very well tolerated. This indicates that EMS training is generally safe and highly acceptable for healthy women in this age group. In conclusion, our study confirms that a properly planned and regularly supervised EMS training program can be safe and effective method to enhance muscle performance and potentially improve quality of life in women. It doesn't appear to negatively affect the menstrual cycle. Of course, as with any research, there were limitations to our study. The sample size was relatively small, and our findings would be benefit from further investigation on a larger scale. Additionally, the study focused solely on a healthy woman of reproductive age, so the results may be directly applicable to other group. Thank you for your attention. For further information, please ask the question.
Congratulations, very interesting study. Please tell what are your contributions to the research?
I made a project of this study. Besides, it's the part of my doctoral study, so I had to make a statistical analysis, which wasn't so easy. Yeah, but we work together with my colleague Anita, so but mainly the project and the statistical analysis was my contribution.
Oh, and next question, what practical influence your results may have on women?
Of course, there is no study in the literature about the menstrual cycle, how the EMS impact of the menstrual cycle. So I think it will be it's more the pilot study, but it will be helping for me to make huger research about the EMS training on the women's, especially the women's pelvic floor, for example, or the menstrual cycle.
Thank you.
Are there any more questions?
No, jak jest cisza, to ja tradycyjnie. When I am a student, I gave with my colleagues EMC, and after it we are measured breath volume. It was studied by Professor Franek. What do you think about it?
I'm sorry, what do I think about what?
I have with my colleagues in my group of students, Professor Franek took us to EMC study with our agreed, and after maybe 10 EMC, we were measured our breath volume. So what is not correlation and relation between breath volume and EMC?
Good question. The EMS training has influence to the muscle, but the like you said, volume breathe too. So I think you can raise your VO2 thanks to the EMS training. And if you wear the suit on yourself, you can say that the EMS training is not so easy. It takes only 20 minutes, but you can raise your muscle, raise your volume, breathe. So I think you can see on yourself that it's really hard training.
Very good, thank you.
Thank you for your contribution. Now I would like to invite the author of presentation exploring the role of chronic neuroinflammation in idiopathic Parkinson's disease.
Good morning, everyone. Today, I would like to invite you to explore the role of chronic neuroinflammation in idiopathic Parkinson's disease. So, dear jury, dear colleagues, let me introduce my work. And I would like to add that today I have an honor to represent a Department of Neurology in Katowice, Silesian University. Okay, so let's go further. This is my outline of the presentation. So I would like to tell you something more about the Parkinson's disease and some main symptoms of this disorder. Then I will introduce you AIM and our study group, and of course, results and conclusions. Okay. So let's explain what the Parkinson's disease really is, which is very important. I have to emphasize that this is the second most frequent neurodegenerative disease. It is second after the multiple sclerosis. And this disability, this disorder leads to disability, and it is associated to many motor or non-motor symptoms. And the circle of non-motor symptoms are, for example, problems with thermoregulation, some perturbations with urination, with miction,
some depression and anxiety perturbances, and also problems with sleeping, for example, in case of these patients. And many genetic and environmental factors have been identified in case of the Parkinson's disease. However, many more and their complex interdependence are yet to be explained, and this is one of the aims of our study. According to the present knowledge which we have, the pathophysiology consists of two substantial processes. It involves aggregation of alpha-synuclein leading to Lewy pathology and degeneration of dopaminergic neurons in substantia nigra, pars compacta. And some of the most common motor symptoms include tremor, rigidity, and bradykinesia. I'm sure you have heard something about these symptoms in the course of Parkinson's disease. Okay, now let me tell you something more about the neuroinflammation. The neuroinflammation is a very special phenomenon which begins in our brains and spinal cords. And it involves microglia and also astrocyte cells. And some markers include CRP, lymphocytes, neutrophils, platelets, as well as ratio such as PLR and NLR. And acute neuroinflammation is usually related to injury to the CNS, whereas chronic neuroinflammation relies on activation of glial and other immune cells. And the chronic neuroinflammation is usually related to many neurodegenerative diseases, such as Parkinson's disease, multiple sclerosis, or Alzheimer's disease. Which is quite important. I have to also admit that neuroinflammation and Parkinson's disease is associated with some pro-inflammatory cytokines, such as TNF-alpha, IL-1 beta, and IL-6. And now we are also performing some researches including this aspect. The aim of our study was to find correlation between chronic neuroinflammation and development of idiopathic Parkinson's disease. We have to check and make analysis of about 1,000 epicrizes from some patients who were hospitalized in the neurology clinic in Katowice. And we enrolled 140 patients with Parkinson's disease among those 1,000 epicrizes. And the inclusion criteria were based on diagnosis of PD according to Movement Disorder Society, which is a scale to measure some movement disorders, problems in these patients, and also to measure how patients can manage with some everyday activities. Data on patients include age of onset, symptoms, and they were collected including MDS Unified Parkinson's Disease Rating Scale and also HONER scale, which is a scale of disability in case of patients with Parkinson's disease. Those are some results of our study. As you can see, we have found a significant negative correlation of lymphocyte levels with age of the patients. What is more, we found a significant negative correlation of platelet levels with age of onset. But as you can see on this table, we have found a positive correlation between neutrophil levels and HY score. As I mentioned, this is a scale of disability, patients with who suffer from Parkinson's disease. Our study also shows a positive correlation between white blood cell levels and HY score. And some other parameters of inflammatory, such as platelet to lymphocyte ratio, which is PLR, shows a positive correlation with a higher levodopa equivalent daily dose. And levodopa is one of the medicines, one of the drugs used in the course of Parkinson's disease with a very good result. And according to conclusions from our study, as we observed, an early onset disease shows higher levels of neuroinflammation and is more conducive to the development of symptoms. In turn, the correlation of PLR with LEDD may indicate the onset of more severe disability in the course of PD and a greater need for medication. And it seems pretty necessary to conduct further studies to verify the conclusions obtained in our work. As what I have to emphasize, it is very important in our survey that an early onset is really connected, really associated with promoting some symptoms. It is quite similar as in the multiple sclerosis and other important disability in the neurology. And also an early onset and a correlation of PLR is associated with more demand for medications for patients. Okay. So thank you for your attention, and I think that's all. I am looking forward for some questions.
I have a too short. What do you think? What is the percentage of being dementia in Parkinson's diseases? And maybe it's two more issues between them. And what do you think? What your study is to connect them?
Thank you for this question. It's a very interesting what you asked me, but as our study showed, as I was prepared some data from the 1000 of epicrisis, the dementia in course of Parkinson's disease and in our patients, the percentage of the dementia isn't very big. It wasn't very big. I supposed it will be much bigger, but it wasn't. I think it's very important to make some further investigations in this field, but this percentage wasn't very significant.
Near 50%.
Yes, but in common in general, but not in our databases.
PubMed. Okay, thank you.
Thank you for your contribution. Now I would like to ask the author of work unveiling the molecular mechanisms of PAC-C2 syndrome throughout proteomic profiling.
Hello. Also my video. Hello. I hope that you see me and you hear me and you see my desktop.
Yes, we can hear you.
Great. Okay. Yes, I need
could
to.
you please fix your camera? Thank you.
Thank you for the introduction. My name is Arkadiusz Wikowski. I represent Medical University of Białystok, and today I have a great pleasure to present my preliminary data associated with the proteomic assessment of PAX2 syndrome. However, before I will go into the data, I would like to inform you about the PAX2 syndrome with this short timeline. PAX2 syndrome is ultra-rare disorder described for the first time in Olson et al. In 2018. She found 2 individuals with the similar symptoms and with the same de novo PAX2 gene mutation. Mutation is localized in the middle region of the protein and is really important for now to understand the PAX2 protein function. PAX2 protein is an intracellular transporter, and this mutation is leading to the modification in the charge of the protein and disrupt association with the cargo proteins. Moreover, Olson found additional 12 individuals by data sharing. All of these patients have same symptoms from the neurological origin. Part of them have also additional organ involvement. But from our point of view, is the most important that Olson decided to study also the molecular mechanism behind this mutation. She found that PAX2, mutated PAX2 protein, has increased interaction with sirtuin-1, histone acetylase 1, and the channel for the calcium. Few weeks after this publication was published, the first Polish child was diagnosed with PAX2 syndrome. Mateusz was diagnosed in age 4. 3 years later, second Polish child is diagnosed with PAX2 syndrome. And this child is really important for this presentation because Lena parents decide that they need to do something because in this moment we don't have any treatment for the child affected by this syndrome. They create the PAX2 Research Foundation. They found scientific partners, among them Medical University of Białystok, in one aim to study and to find treatment for the PAX2 syndrome. In 2022, Zhang et al. Expand our knowledge about the molecular mechanism behind this mutation. He found that the staurosporin, the cells that with the PAX2 mutation affected by staurosporin have increased ER stress and increased apoptosis response to this stressor. 1 year later, Zhang et al. Also add some crucial information. He found that the PAX2, mutated PAX2 protein cannot be phosphorylated by CT2A1 kinase and therefore cannot transport the PAX2 protein from the Golgi apparatus to the endoplasmatic reticulum, and therefore the flux of the calcium ions is disrupted in the cells. As you can see, the calcium ions are accumulated in the cytoplasm, and this can disrupt the metabolism of the cells. Unluckily, all these experiments were conducted on the cancer cell lines with the artificial overexpression of mutated PAX2 protein, and this is the strong methodological limitation because this not reflects really well the PAX2 syndrome and the situation of the, let's say, cells from the PAX2 syndrome patient. However, in 2023, in April, the first mouse with PAX2 syndrome was born in Medical University of Białystok, and now we know that there is approximately 100 patients worldwide affected by PAX2 syndrome. 6 of them were born in Poland. For now, there is no treatment for PAX2 syndrome. We can just manage the epilepsy. Our understanding of this syndrome is also really limited. However, now we have much more powerful tool to study PAX2 syndrome. Of course, I mean our model, animal model. And because of it, we decided as a first group in worldwide to assess the proteomic profiles of different tissue collected from PAX2 syndrome mice. So we used 6 mice with PAX2 syndrome and 6 wild-type mice. We collect different tissues like aorta, like bone, cerebellum, cortex, heart, hippocampus, kidney, liver, muscle, and spleen. So in total, 120 samples. We, of course, homogenate the tissue and we isolate the proteins. Now you can see the table with the total identifiers from the protein. As you can see, cortex is still in the progress because we still work on this data, and I don't have the data from the cortex. Our data were analyzed with help of DIA analyst and Spring software. I will present you now my results. All results we will present with the help of the Volcano plots. As you can see here, you see the dashed line. Dashed line represent the cutoffs for the log to fold change, and they were set on -1 and 1, which represent 2-time decrease or 2-time increase expression of the protein. You don't see the dashed line for the p-value cutoff because p-value was correct, was adjusted by Benjamin Hochberg correction for multiple t-testing as depend, and it depends on the number of the protein, number of the t-tests we perform in each data set. And as you can see in the case of aorta, there is no differences between PAX2 and control animals. Same situation in the case of the, I don't see what kind of tissue I have because, sorry, in the case of the bone, I guess. In the case of the cerebellum, we have just 3 down-regulated protein. And for us, the sortilin is the most important because sortilin share the same function like PAX2 protein, so it's the intracellular transporter. In the case of the heart, again, no changes. In the case of the kidneys, we see just 1 upregulated and few downregulated protein. Between them, syntaxin 12 is important for us because, again, it's sharing same function like PAX2 protein. In the case of liver, we see few upregulated, few downregulated protein. A majority of them are the transporter and channels. However, the third position in upregulated protein, biglycan, is really important for us because biglycan is a protein which is necessary to assemble the collagen within the tissue. And I will tell you at the end of the presentation why this protein is important for us. In the case of, again, I don't see what, sorry. In the case of the skeleton muscle, again, no changes. In the case of spleen, cytochrome C is upregulated. However, when we will go to the next tissue, we see massive changes because in the case of the hippocampus, we see the massive upregulation within PAX2 and massive downregulation. So in total, we have almost 270 upregulated protein and almost 200 downregulated proteins. And when we will go deep to analyze them, we see that the downregulated pathways are mostly associated with the cellular organization or with the transportation within the cells. So we have downregulation in top 10 in synapse organization, cell junction organization, the cellular localization, the protein localization, intracellular transport, and other transportation function. In the case of the top 10 upregulated pathways, the majority of them are associated with the mitochondrial metabolism like cellular respiration, like generation of precursor for the metabolism and energy, ATP metabolism, and sodium and potassium homeostasis. And our conclusion, it's visible for us that PAX2 protein have tissue-dependent effect, and the central nervous system appears to the most significant effect by this mutation. And these findings are consistent with the clinical manifestation because the main symptoms are associated with the neurological conditions, and all patients have these symptoms. And because of it, we believe that our model reflects really well PAX2 syndrome and is much more better than in vitro models which were used before us. And of course, the changes in the molecular pathways with the hippocampus confirmed the observations from the in vitro models. However, we also significantly expand them. And what we also know that we need to expand our sample size in order to enhance the power of the statistics test to draw more precise conclusion. And thank you for the attention. I am open for your question, of course, but before it, I would like also to invite you to another presentation, and this presentation will be on the Friday, the presentation associated with the histological characterization of PAX2 syndrome presented by our scientific club students, and you will learn why biglycan is important in this presentation. If you also wish to learn more about PAX2 syndrome because it's an unknown disorder, you are welcome to read our recent publication. And now, thank you for the presentation one more time. Thank you guys for the help with this work, and I am open for the question.
Now moving to the discussion, we kindly ask jury for any questions. So let me ask you a question.
Of course.
What was your inspiration to this work?
Inspiration. It's really a good question because the main purpose why I present the study here is not to share the data with you, but to share the disease with you. PAX2 syndrome is unknown disease. As I showed you, it was discovered in 2018, and my main aim was to show you the disease, show you this problem, because people don't know the problem of ultra-rare disorders. And the main inspiration is just to study this disorder and to help in the process of finding the treatment. And we believe that our, let's say, molecular study, because we found a lot of potential molecular targets, could be helpful in finding the treatment. And as I said, we also expand a little bit our knowledge about PAX2 syndrome, because we don't have information about the blood-brain dysfunction in the PAX2 syndrome, no data from the clinical thing, but we found in our data that the blood-brain dysfunction could be present and could be associated with the astrocyte in the case of PAX2 syndrome. So that I said, we wish to just expand the knowledge about this syndrome and to find the treatment at the end. I hope it will be possible.
Thank you. Are there any other questions? In that case, moving forward, I would like to invite the author of the work named Evaluation of Pharmaceutical Packaging Protective Properties.
Yes, can you hear me?
Yes, we can.
Okay, wait a second, I will share the screen. Is it full screen? Can you see it?
Yes, we can.
Okay, so let's start. Good morning, respected members of committee and fellow researchers. My name is Dagmara Kuca, and I'm a veterinary medical doctor, and I represent the Department of Basic Biomedical Sciences at the Medical University of Silesia in Katowice. Today, I would like to present selected results of my research. Okay. Let me adjust. Yeah, many active pharmaceutical ingredients are photosensitive and might degrade with exposure to electromagnetic radiation, such as ultraviolet, visible, or near-infrared light. This is particularly important for the veterinary drugs, which are more likely to be exposed to suboptimal storage conditions, especially in field settings. Photodegradation, as we know, reduces drugs' efficiency and might also generate harmful degradation byproducts. Two examples of light-sensitive pharmaceuticals are digoxin and doxycycline, and I chose to research them. In this study, I evaluated the photoprotective properties of their commercial packaging using hemispherical reflectance measurements, thermal imaging, and hyperspectral imaging. For digoxin, 3 commercially available products were analyzed, and the reflectance was measured using the Solar 410 hemispherical reflectometer from Surface Optics Corporation. And this instrument operates in the spectral range of 335 to 2,500 nanometers, with the focus on the ultraviolet blue region, which is the most relevant for the photodegradation. Measurements were performed on 4 packaging components: tablet, blister foil, plastic layer, and outer carton. In the other part of the study, 8 commercial doxycycline products were evaluated. Packaging layers included capsules or tablets, blisters made of polyvinyl chloride or polyvinyl chloride, and also the outer cartons. Spectral reference was again measured using the same equipment. Additionally, the thermal analysis was conducted using the FLIR thermal imaging camera with the spectral range range of 7.5 to 13 micrometers and thermal sensitivity below 0.045 Celsius degrees. Capsules were exposed to infrared radiation for 180 seconds using the halogen infrared emitter, which was placed 10 centimeters above the sample. And a hyperspectral imaging was also introduced using the IQ camera from SIMC, operating at the range of from 400 to 1000 nanometer range. Yes, reflectance results for digoxin showed significant variation depending on the packaging layer. Tablets show the lowest reflectance, indicating high susceptibility to photodegradation, and the outer cartons had the highest reflectance in both UV and NIR ranges, confirming their superior protective properties. This finding confirmed the importance of using multi-layer packaging. A similar trend was observed for doxycycline. Reflectance increased with the additional packaging layer. Tablets and capsules had the lowest reflectance, followed by blisters, while outer cartons show the highest values in both UV and NIR ranges. This consistency across both drugs supports the robustness of this methodology. And the last method I used for checking the spectral image is the hyperspectral imaging, which was used to assess the reflectance of the packaging surfaces. Preliminary results were consistent with the hemispherical reflectance data, and they confirm higher reflectivity in a multi-layer packaging. However, due to the limited spectral range of the hyperspectral camera and its sensitivity to external condition, this method was more complicated to use, and I think hemispherical reflectance is better for this purpose. So those are the limitations. Yeah, and the last part of the research was doing the thermal imaging, and it was performed on doxycycline capsules in 3 packaging configurations. The unprotected capsule reached the surface temperature of around 45 Celsius degrees. And in contrast, the blister and carton combined maintained the final temperature below 35 degrees. And this demonstrates the thermal shielding effects on multi-layer packaging, which completes its optical properties. And now I would like to say that in both doxycycline and digoxin studies, outer cartons show the highest reflectance across both UV and NIR regions. Tablets and capsules were the least protected. Multi-layer packaging significantly delayed thermal accumulation. These results, they confirm that packaging designs plays critical role in protecting pharmaceutical from the electromagnetic radiation and thermal stress. And the use of reflectometry and the thermal analysis can provide a reliable and also not destructive method for evaluating packaging effectiveness. In the next phase, we plan to use broader the hyperspectral imaging because of its.
We kindly ask to move to the conclusions due to the limited time.
Okay, yeah. The conclusions are now presented. Actually, we are planning to use modified filters mixed into the tablets. It could be titanium dioxide, zinc oxide, or bentonite. And the accelerating aging test will be conducted to explore the long-term impact of the optimized materials. And that's all. Thank you for your attention, and I'm happy to hear any question from you.
Are there any questions from the jury? So we would like to ask you, what was your contribution to this work?
Mm-hmm. So I designed the experimental protocol for the reflectance and thermal imaging analysis, and I selected the representative veterinary pharmaceuticals, defined their analytical scope, and I planned the experimental design, also performed the spectral and thermal measurements, analyzed the data, and prepared the interpretation of the results.
Thank you. Now
Thank you.
moving to the next presentation, bioinformatic identification of blood biomarkers linked to MER9 and MER229 after stroke. We kindly ask Mr. Arkadiusz to shut down the screen share.
Good morning. My name is Susanna Szostak, and today I would like to tell something about our study, which is bioinformatic identification of blood biomarkers linked to MER9 and MER129 after an ischemic stroke. So at first, let's tell something about background of our study, why we decided to choose this topic. We know that an ischemic stroke is one of the leading causes of death and disability in the world. So we hope that if we detect an ischemic stroke early, then we can apply some treatment methods earlier, which can lead us to better outcomes. And also, we can predict some outcomes of this ischemic stroke when we find this using some biomarkers. So we also know that microRNAs are great biomarkers that can be easily found in bodily fluids like blood or plasma. And something about these microRNAs, those are small non-coding RNAs, which are involved in post-transcriptional regulation of gene expression. They don't code any proteins, they only regulate those transcription. And previous studies on Department of Physiology at Medical University of Silesia suggested that altered expression of MER9 and MER129 can be found after an ischemic stroke. So that's why we chose to search something about those targets, because we know that they can be exactly biomarkers. Okay, so the aim of our study was to identify common biomarkers and biological pathways regulated by MER93P, MER95P, and MER129-5P after a perfusion in ischemic stroke. And we used an in silico analysis to reach this goal. Okay, so our method. At first, we got 2,265 targets from MERDB database. Those database suggested us potential targets, and then we wanted to check if they actually can be useful in our studies. So this was the next step when we searched medical databases, including PubMed and Google Scholar, and we searched all of these targets to see if they were previously used in any studies made by other scientists, because we wanted to see if they actually can be found in any bodily fluids of human or animals like rat and mouse. We focused only on bodily fluids, including blood, plasma, and serum, not on tissues, because we already have got these blood samples from patients. So we want to perform next stages of our study using those samples. So that's why we chose on blood. And then we excluded targets that we didn't want to use. For example, this including only animals. So we focus on human
the next step was to exclude all the targets that weren't detected using ELISA or Western blot methods, because these are the methods that we can actually use. So we focus on them. And then we focused only on nervous and cardiovascular system because we do research about ischemic stroke. So those two systems are most connected with stroke. And finally, we got 33 targets after including all PBMC cells. So we got 33 proteins that were linked to neurodegenerative diseases and vascular and endothelial disorders. And we found that those proteins had high activity during brain, platelet, and tissue development. And then we used string analysis. So string is a program, computer that use bioinformatics to show us some potential connections between those proteins, because like those targets here are those we got from our study. So then we wanted to see any connections between them, like for example, if they take part in the same process or in the same tissue, and these are the map of our connections. And string database also searched for us some various medical databases and gave us some data, which I will present now. For example, one database suggested that our proteins were highly expressed in head and brain, which are the place where ischemic stroke take part. Other database suggested us that, for example, the disruption of postsynaptic signaling by central nervous system happened. Other one suggested like the role of EGF like domain. Other one suggested some role on platelets and synapses, which just tell us that exactly those proteins were connected with ischemic stroke, and our study search exactly something that we wanted to see. And this huge base showed us some interesting facts. For example, that those proteins were also connected with axonogenesis or even aging. And other database showed us also the platelets and synapse and much more roles in those proteins take part in. So our conclusions are that MER93P, MER95P, and MER195P indeed regulate key pathway in ischemic stroke. And also, we got some potential new biomarkers for severity and recovery after ischemic stroke, but we need to validate them using some in vitro methods. And this may guide us some therapeutic strategies post-stroke. And our references are MERTP and string. And thanks for attention.
Thank you. Are there any questions from the jury? So we would like to ask you, what was your contribution when it comes to the laboratory work?
We didn't go yet to the point when we do anything in lab, because we just wanted now to search what we can do in this lab. But the next stage of our study would be validation those targets in laboratory, but we didn't reach it yet.
Thank you. And what was your overall inspiration for that?
Our inspiration was the fact that those targets were already searched in some another research made by Faculty of Physiology.
Thank you very much. Thank you for your contribution. Now moving to the next presentation. The steroid signatures of newborns, clinical applications of metabolomic profiling in neonatal care. Let me know.
Okay, so good morning, ladies and gentlemen. My name is Miłosz Lorek, and I would like to present a study concerning the metabolome signature of newborns and discuss its clinical applications. So let me start by clarifying the concept of steroid signatures and metabolomics. Steroids and their precursors are produced in the steroidogenic tissues, and then they circulate in the blood and finally are excreted in the urine. So by obtaining the blood or urine and using the mass spectrometry analysis, we can obtain a full spectrum of steroids referred as the steroid profile. This steroid profile, once normalized, can serve as input data for steroid metabolomics, which integrates the... Yes, okay. Start over. Should I just continue or start over? Okay, I will start to discuss this slide again, okay? Okay, so if steroids and their precursors are produced in the steroidogenic tissues, they circulate in the blood, and finally they are excreted into the urine. Therefore, by obtaining blood or urine and using mass spectrometry analysis, we can identify the full spectrum of steroid and metabolites, also referred as steroid profile. Once normalized, steroid profile can serve as a data input for steroid metabolomics, which integrates the machine learning algorithms and multidimensional analysis to reveal the steroid fingerprints, which are the complex biochemical patterns. Okay, and based on the most recent studies that identified the altered steroid profile in the cerebral hemorrhage and bronchopulmonary dysplasia among neonates, we were able to make a following hypothesis: that newborns admitted to the intensive care unit can be assigned with a unique steroid metabolome profile correlated with a clinical phenotype and enzymatic activity. This profile may serve as a basis for assessing the risk for BPD or IVH and implementing personalized therapeutic interventions. So in this study, we enrolled 50 consecutive newborns admitted to the ICU with the respiratory distress syndrome and who were catheterized by Foley to monitor the daily urine output. On the third day of life, all patients underwent 24-hour urine collection to determine the steroid profile through GCMS. And at first, we confirmed the relationship between development and steroid profile. The full-term neonates had higher concentrations than the very preterm. Additionally, we established the correlations between anthropometrics and steroid concentrations. So this led us to the initial conclusion that the standardization of steroids is necessary for further proceedings. In order to address that, we performed peer group normalization. It is an advanced technique proposed by Vitkin, which is based on the similarity score index. The similarity score is calculated on the basis of the previous identified correlations, and therefore we identified the 10 most similar neighbors for each newborn and performed the normalization within this group for each newborn. And the results of this normalization is presented below. As you can see, after the PGN, the distribution were symmetrical,
and 27 out of 30 analyzed metabolites exhibited a normal distribution. Moreover, no correlations between anthropometrics and steroids were identified after the PGN. Moving to the metabolomics part of the study, we utilized the clustering algorithm to identify 3 clusters, which are visible in the top margin of the heat map and in the PCA plot, which presents all analyzed steroid profiles displayed into 2-dimensional space. The specifics will be discussed later on. Moving to the results summary, the cluster did not differ, did not regard to prematurity, gestational age, or body weight, which indicates that the normalization was successful. Cluster 1 was characterized by the highest rates of small for gestational age or intrauterine growth restriction. Additionally, they had the highest mortality risk expressed by the SNAP2. Moreover, the highest dysplasia risk compared to the opposite cluster. Cluster 2, on the other hand, had the highest risk of intraventricular hemorrhage and the high mortality risk. Cluster 3 had the best clinical outcome. Moving to the biochemical summary, the graph represents the steroid profile of 3 identified clusters and the differences in enzymatic activity. So cluster 1, okay, I will move to the conclusion. So cluster 1 presented adrenal suppression, cluster 2 presented adrenal hyperactivation, and cluster 3 had a robust steroidogenesis. So moving to conclusions, we can use steroid metabolomics in targeted steroid therapy. Cluster 1 may particularly benefit from the targeted steroid therapy. Cluster 2, the steroid therapy should be delayed or withheld due to risk of IVH, and the cluster 3, the steroid therapy may not be necessary. Also, according to the long-term health trajectories, according to the theoretical basis, cluster 1 has a potential risk of suboptimal neurodevelopment. Cluster 2 had a predisposition to hypertension, and cluster 3 had a risk of reproductive complications. So thank you for your attention. Sorry for the overtime, however, there was technical issues at the start, and I'm happy to answer the questions.
Congratulations, very interesting study. Have you any limitation of your study?
Well, my limitation of the study was the sample size, which has 50 newborns. However, and the population is so specific, there are newborns who required catheterization. So it is very hard to obtain the bigger population group. We were gathering. I was recruited to the study group for almost 2 years.
And tell us what's your contribution to the study?
I recruited all the patients. I gathered all the samples from the patient on the ICU which I work in. And then storage them in the freezer. I also organized the transport to Warsaw to perform gas chromatography mass spectrometry analysis. I analyzed the steroids. I performed the normalization, the metabolomics part of the study, and draw the final conclusion.
Thank you very much.
Thank you.
Thank you for your contribution. Now moving to the final presentations of this session, the assessment of cfDNA concentration in patients with schizophrenia.
All right. Good morning, ladies and gentlemen. My name is Łukasz Czegalik, and today I will present the findings on our study titled Assessment of cfDNA Concentration in Patients with Schizophrenia. This project was conducted in collaboration with the Department of Psychiatry and the Department of Histology and Cell Pathology at Medical University of Silesia. Here's the title again. And here's the agenda of today's presentation. We'll begin with some background, then we'll move to explanation what cfDNA is, then the aim of the study, followed by the materials and methods, key results, then conclusions, and finally there will be time for discussion. Well, cell-free DNA, or cfDNA, refers to extracellular DNA fragments released into bloodstream, mostly as a result of apoptosis or necrosis. In recent years, cfDNA has become a well-established biomarker in fields such as oncology, transplantology, prenatal diagnostics. And beyond these clinical applications, the potential uses of cfDNA are being intensively investigated across various areas of medicine. For example, even at our own university, there are researchers exploring the use of cfDNA diagnostics in myocarditis. In our project, we are seeking to determine whether cfDNA could serve as a useful biomarker in psychiatry, especially in schizophrenia. Schizophrenia's pathophysiology remains poorly understood, but increasing evidence points to neuroinflammatory and neurodegenerative mechanisms. These pathological changes could manifest as alteration in cfDNA levels, which we aimed to investigate. Our study aimed to evaluate the concentration of total cfDNA, nuclear cfDNA, and mitochondrial cfDNA in patients diagnosed with schizophrenia compared to healthy controls. We also wanted to investigate whether cfDNA levels were associated with symptoms, symptom severity, age, and sex of patients. This research project began in 2023. We enrolled 30 patients diagnosed with schizophrenia and 30 matched healthy controls. The study group psychiatric assessment included the use of SAPS and SANS scales to quantify positive and negative symptoms. Venous blood samples were collected and cfDNA were extracted using the MAC-Core+2 systems. The total cfDNA concentration was measured fluorometrically, while copy numbers of CF nuclear DNA and mitochondrial cfDNA were determined via droplet digital PCR, or ddPCR. The use of ddPCR in our study represents an innovative approach in psychiatric research. To the best of our knowledge, we are the first group to use this technology in this context. This method offers high sensitivity and precision in detecting and quantifying low amounts of nucleic acids, which is particularly important when analyzing cfDNA in the blood serum. And finally, the laboratory analyses were completed at the end of the 2024, and statistical analysis and interpretation were finalized at the beginning of this year. Our analyses were performed by Python with the significance level set at alpha equals 0.05. And final results. Our primary finding was that nuclear cfDNA levels were significantly higher in the schizophrenia group compared to controls, with p-value at 0.03. This result suggests that nuclear DNA fragments in circulation may be linked to cellular stress or damage by schizophrenia, reflecting positive underlying neuroinflammatory or neurodegenerative processes. Interestingly, we also observed significant sex-related differences. Males had higher concentrations of total cfDNA than females across all subjects, and specifically within the control group, where men had higher nuclear cfDNA levels. This points of possible hormonal or metabolic influence of cfDNA regulations, which is important for future studies and interpreting data. Thank you. Another noteworthy finding is that a positive correlation between age and mitochondrial cfDNA levels, but only in the control group females. The correlation coefficient was R equals 0.66, indicating a moderate to strong association. This may reflect as age-related mitochondrial changes that are less convenient or differently expressed in patients with schizophrenia. We found no significant correlations between cfDNA levels and clinical symptom severity as measured by scales SAPS and SANS. That suggests that while cfDNA may reflect underlying disease biology, it may not directly correlate with observable psychiatric symptoms, and at least in our cross-sectional analysis. Jumping right to the conclusions, schizophrenia patients exhibit significantly elevated nuclear cfDNA levels, and sex and age are significant modifiers of cfDNA concentrations. cfDNA does not correlate with symptom severity, suggesting that it may reflect broader pathophysiological processes rather than clinical presentation. And finally, to more and more interpret these findings, the elevated nuclear cfDNA in schizophrenia patients could indicate ongoing cellular damage or turnover, potentially driven by neuroinflammation. Sex and age appeared to modulate cfDNA levels, further emphasizing the complexity of cfDNA dynamics and the importance of controlling for demographic variables. However, the absence of association with symptom scores highlights the need for caution. cfDNA may serve better as a biological marker than a diagnostics one. We believe that larger longitudinal studies are essential to determine whether cfDNA can serve as a reliable biomarker for disease progression or treatment response in schizophrenia. Thank you very much for your attention. Now I will be more than happy to answer any of your questions. Thank you.
I have a question because it is my question. We have by Jeffrey Lieberman three positions of think of schizophrenia, study schizophrenia. There are phenomenology, pathogenesis, and etiology. In what position is your study?
Sorry, may I have this question one more time?
Okay, we have three positions of our thinking to study medicine, study schizophrenia. In schizophrenia, we have symptoms, as it is phenomenology. After it, we have study relates to pathogenesis or pathogenetic, and free position is etiology. It's free position to study schizophrenia. In which position is your study? You don't say about etiology, phenomenology. Okay, it's not, but you have as pathogenesis and etiology. Where is your study? In pathogenesis or etiology?
Moreover, pathogenesis and well, I would say that this study is still in early front of research, including cfDNA. So we're like more like discovering new ways of finding out on which area the cfDNA concentration will be used for pathogenesis or other fields. So I think that we're still on the early state of knowing on which field this marker will be the best of use. Right now, we would like to broaden the group, for example, for newly admitted patients, because our group was basically patients with many hospitalizations and long history. And then on broader group with many other variables, we will be able to tell on which field this marker will be will have the biggest potential. I hope that I answered as you want.
Okay, but etiology is, with etiology we go to recognize one or some the indicators. Your study, not indicators of schizophrenia, but it may be about pathogenesis, and you look on, you are looking some issues, your theme and another theme about dopamine, GABA, and more. Yes? Do you agree?
Yes, I think I agree. This is more over diagnostics than seeking the mechanisms.
Thank
you. Due to the limited time, we have time for one more questions. I saw Mr.
Thank you very much for the possibility to give one question. So my question is pretty simple. Actually, what do you think about the specificity of the cfDNA? Is there any more common reasons why you observe the increase of this marker? And secondly, how was composed your control group, and do you think it was appropriate for your study or not?
These are two brilliant questions. Thank you. At the beginning, well, cfDNA is not the whole spectrum of cfDNA is not as specific as we want it to be. This is why, for example, we conducted the study not to include patients with severe symptomatic diseases, somatic diseases, because, for example, when there comes to some tumors or other diseases, the cfDNA level is significantly higher. For example, when it comes to smoking cigarettes, the level is also really increased. But the fractions we measured using PCR are really specific, especially for brain, the special parts of brain, the mtDNA and nuclear DNA, and these markers are really good for the purpose. And the second question, the control group, yes. Well, I think, yeah, the control group was the composition of the group was good when it comes to age and well, the status of the people who participated. The people were from the same area, from for the Silesia region, and maybe we can take more data into the whole study, but it also would be helpful when the study group will be broad.
Okay, but the control group were generally composed of 30 people. Yeah? So I think that this is the main problem, because you should use as a comparison for the comparison as the people with different diseases, which reflects the spectrum of disease observed in the schizophrenia patients.
This is a great idea. I think we should involve it in our next studies. Thank you.
Thank you for your contribution. To summarize this session, we would like to kindly invite Dean Tomasz Francuz and Director of Doctoral School, Dr. Agata Stanek, to jointly share their reflections and summary of the presentations. Okay. Is Professor Stanek with us right now?
I am present, dear PhD students. I would like to congratulate you, your presentation. The lectures were very interesting, and I keep fingers for your rapid publications.
Invitation, and let me thank you for the invitation and congratulate you all the participants. The exciting work, this is the beginning of your scientific career. So of course there are some small mistakes, maybe something should be improved, but in general it was really beautiful, exciting evening for me. So once again, congratulate. Unfortunately, I think that there could be only one winner. However, everybody here performed really, really well. So it's a very hard task for the whole jury, I think, to judge you and to indicate the persons who, in our opinion, performed the best today. Once again, congratulations.
Thank you, everybody. And right now, I'm honored to invite you to the lunch.